overcrowded and people aren't following the rules, get off the bus. If a strip club somehow has found itself open under the rules as they exist, don't go there. If you're at a party and it's getting overcrowded and people are not wearing masks, then please leave under the rule. These are some actual examples of behaviors that we can influence the spread or the non-spread of this virus through our own personal behavior. And there are examples of things people have actually done that similarly boggle the mind but also operate as a lesson to all of us. We heard this morning, for example, on our command call we have each morning, about a case where a family got together with a relative to comfort them and support them, as you would expect, but they got together with a relative who they knew had COVID-19. And after they came back from that get-together, some of them ended up in Toronto testing positive for COVID-19. How does that make any sense? It's behavior like this that is leading the virus to continue to spread in our community. We do not want to go backwards. We do not want to have to go back into a further lockdown due to the thoughtless actions or people just not thinking about the basic advice that they've been given by our expert medical officers of health and by all of us as leaders. We made enough progress fighting COVID-19 through the spring and summer that we're able to move forward with the safe restart and reopening of our economy. But keeping it safe so we don't have to go backwards, requires not just leadership and rules from the Premier or the Mayor or the Medical Officer of Health or anybody in government officialdom. It requires common sense and compliance from individual people, every single one, without exception. Never has there been a more important example of the fact, and it is a fact, that you cannot legislate common sense. And yes, it's about health and saving lives most importantly, but it's also about saving jobs and businesses that we all rely on for our collective well-being. And that is why we created things like Active TO and Curb TO and Cafe TO to help businesses get through this and make summer more enjoyable for people during a pandemic. And that is why I've asked the city manager to look at how we can improve and expand those programs for next year. That is also why we launched Show Love TO this morning, so that we can give people ways to enjoy and to love their city, as I know they want to do, but to do it as safely as possible so that our economy can come back strong and so that people can recapture a bit of that joy about being a Torontonian. But we very much present all of these things within the context that people have to do whatever they have been advised to do in order to keep the city safe and healthy, while at the same time opening it up and bringing a bit of a sense of joy back to our lives after months of very miserable circumstances. So in thanking the vast majority of people who are behaving in a sensible and considerate manner, I also ask for your help. I plead for your help in assisting those who are not following the rules to get with the program. We can do better than this. We can do better than this. We've been doing okay, but we can do better than this. And in fact, the standard we should be setting is that we have to do better than this. It's not that complicated. It is a matter of life and death and health and respect and consideration for others. And as Torontonians, we're generally pretty good at that. On that note, I will ask Dr. De Villa for her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. Since our last report, we have continued to see a steady and worrisome increase in new COVID-19 infections in Toronto. Today, I'm reporting 264 new COVID-19 infections in our city. This is the number of new cases since Friday. It is not a single-day increase. This new count brings our total COVID-19 cases to 16,873. A total of 14,999 people have recovered from the virus. There are at present 25 people in hospital with COVID-19, and 5 people are in ICU. This is a noted change that our hospital partners have recently highlighted. Our focus must be on what each of us will do to reduce the risk of spread. Remember, these new infections I've just told you about occurred within the past couple of weeks, and there continues to be virus spread in our city. This means we should expect that our case count will go higher. I'll return to the numbers in a moment, but first I want to talk about the return to school. I know that there is unease. That's natural when doing something for the first time in a long time, and especially in our world with COVID. I've said that I'm certain there will be cases in our local schools. This isn't to say that schools will always be the source of the infection. But wherever it comes from, here's what will happen and what you will be told if there's a case of COVID-19 at your child's school. Typically, the first to know about a confirmed infection is the person who has the infection themselves, or in this case, their parent. COVID-19 test results are like any other medical information. They're private. But remember, if your child gets a positive test result, you must let the school know and keep your child at home in self-isolation. 3 things happen next. First, the school system will let my team at Toronto Public Health know about the case. Second, my team will call you soon after to help guide you through the coming days and weeks thereafter. We'll also ask for your help with the contact tracing process. This is so important to help limit the risk to other people. Contact tracing is the third part. We will make a quick decision about whether the facts indicate an infected student's class or cohort needs to be kept at home to self-isolate. And we will contact you if the decision applies to you and your child. All parents will be told if there is a confirmed case in their child's school. If your child is not part of an affected class or cohort, they can continue to go to school as usual, but you should monitor your child for any signs of illness. Remember, anyone who is at high risk is contacted first to get them into self-isolation and away from other people. So now, let's get back to the case count. Let me give you some examples of how and where we're seeing COVID infections in our city. So we know of a big family gathering where there was very little mask wearing and too much close contact. Our case investigators were told by those involved, we're family. We didn't think we could get this disease from each other. But of course, infections resulted. We also know of infection that resulted from a family trip where part of the time was spent with a person confirmed to have COVID-19. And over the weekend, there were reports of a busy restaurant where a performer was moving from table to table, unmasked. It was noisy. People were close to each other and had to lean in and speak loudly in order to be heard. This is a situation where an asymptomatic carrier could easily spread infection to others. Here's what this information doesn't mean. It doesn't mean you can't spend time with family and friends. It doesn't mean you should stop going about your daily life. And it doesn't mean that one place is safe or that some other place isn't. It just doesn't work that way. Every place is a question of low, medium, and high risk, determined in part by what goes on there, and in a very big part by what steps for self-protection you take while you're there. So here's what this information does mean. It means that we can't tell who's got COVID and who doesn't just by looking at them. It means people aren't immune from COVID-19 because you're related to them or because they're your friend or your coworker and they don't look sick. It means if you have COVID-19, you should stay away from other people. You should isolate until a medical professional tells you you aren't infectious anymore. When I provided those examples, I bet you just said to yourself, well, I'd never do something like that. I bet the people in the examples thought the same thing. In some instances, I know they did. They said so. These aren't bad people. This is just human nature. We want to socialize, and we want to be together. We want to be close to one another, and we want to spend time with people we love. We want to believe that COVID-19 will only infect other people. But that's probably the biggest mistake we can make right now. We can't do many of the things we used to do right now. Not in the ways we used to, not in the ways we want to. This is hard to hear, and it's even harder to do. I get that. And I wish I could tell you otherwise. But the fact is, you need to know that where we go and what happens to us depends enormously on the choices we make. You are not powerless. You can protect yourself. You can protect others. You just can't act like nothing has changed. If you do, there's a real chance you're going to get sick or you're going to make somebody else sick. Your decisions and your choices are the most important part of living with COVID in our community. Last spring, it was easy. The vast majority of us stayed at home, apart. We saw what happened. COVID infections declined. But last spring was also really hard. There are hard costs to being kept apart. But it isn't the only way to fight back against COVID-19. The most powerful weapon in the fight against COVID-19 is you, the people of Toronto. And right now, we've got to come together again, just like we did last spring. Whatever you do that brings you into contact with others, ask yourself first, do I have to do this? If I do, am I taking the steps for self-protection that I advise each time I speak with you? Watching your distance, wearing your mask, and washing your hands. The current case count in Toronto is concerning. I'm asking everyone in our city to take a few simple steps for self-protection. Watch your distance, wear your mask, and wash your hands. I know some people find it hard to believe something so simple could make such a big difference. But I promise you, it's really true. If you're always taking these steps to protect yourself, logic dictates that we can gain control over our numbers and still live more freely than we did this past spring. These 3 steps for self-protection work together to create a powerful sequence of actions that reduce virus spread. And they really, really do work. I'll now turn it over to Chief Pegg for his remarks.
Thank you, Dr. De Villa, and good afternoon. More than 9 months ago, we began working with Dr. De Villa and Toronto Public Health in preparation for the impending arrival of the coronavirus. The evaluation and proactive planning for what would soon be known as COVID-19 was underway long before the first case was reported in Canada, let alone in Toronto. Since the arrival of the first case in Toronto, we have managed through the period of shutdown and into the phased reopening of many aspects of our city. Together, our city has built and continues to operate the largest incident management system in our history. Our Emergency Operations Center has operated continuously now for 188 days in response to COVID-19. Throughout our response to COVID-19, we have never wavered from our overarching goal of saving lives and preventing our healthcare system from becoming overwhelmed. From the outset, we have built and operated robust and scalable systems that have enabled our city to respond to the ever-changing realities of this pandemic. Since the beginning of this emergency in Toronto, the city's corporate leadership team has been hard at work, ensuring that we are able to deliver the services that our residents need and rely on each day. Over the past number of months, under the leadership of Deputy City Manager Tracy Cook, our teams have been hard at work, bringing city services back online, while also continuing to prepare for a potential resurgence of COVID-19 as we head into the fall and winter months. Today, I'm very proud of the fact that 94% of city services are operational, with 67% of those services operating remotely through enhanced technology. All essential and critical services have remained operational throughout the pandemic without interruption. And the handful of services that have not been restarted are those that would require in-person attendance and would necessitate opening our civic facilities to the public. More than 180 city services have moved through the Consolidated City Service Restart Roadmap process that we developed and implemented in May. Perhaps most importantly, the vast majority of our city services are now being operated in a manner that enables enhanced continuity of service in the event of a continued resurgence of COVID-19. It is with this mandate and focus in mind that I have now been asked to return to the position of COVID-19 Incident Commander. My focus will include continuing the proactive planning and preparation that has been underway throughout COVID-19. Our consolidated COVID-19 resurgence plans will guide the city's response moving forward. We will continue to manage the challenges that COVID-19 brings, including those relating to the global supply chain of personal protective equipment. As the resurgence situation develops, we will continue to take the actions necessary to save lives and to prevent the healthcare system from becoming overwhelmed. I would like to extend my thanks to Mayor Tory and Dr. De Villa and the city's senior leadership team for their continued trust and confidence in my ability to take on this important work once again. I would also like to acknowledge each and every resident and business owner who has accepted and abided by our advice and direction as we have worked together to beat COVID-19. I encourage everyone to continue to follow the advice of Toronto Public Health as we do all we can to minimize the resurgence of COVID-19 in our city. And finally, I would be remiss if I did not remind everyone that toronto.ca/COVID-19 is the best source for reliable and timely information on COVID-19 in Toronto. Thank you.
Thank you, Chief. We'll take questions in a moment. For reporters on the line, so you know, we have staff from Transportation Services, Shelters, Parks, Forestry and Recreation, Municipal Licensing and Standards, and Senior Services and Long-Term Care on the line, should you have specific questions for them. First question is to Sean Lathong from CTV News. Sean, go ahead, please.
Okay, thank you very much. This question's for Dr. De Villa regarding schools. As we're seeing numbers in Ontario go up, I was wondering what possibly would be a threshold for case count in schools for a school to be shut down or for all schools to be shut down?
So, Sean, I think when it comes to specific actions that are going to be taken or considered by public health, they always have to be informed by the best available evidence. And some of that is going to be premised on local data and case counts and the like. Some of this is going to be premised on other jurisdictions' experience, and some is going to be premised on what we know from the scientific literature. So there isn't a single number or indicator that will dictate a specific course of action. Rather, it's the sum total of what we're seeing in order to mitigate risk as much as possible. But when I think about what makes our schools successful, or what will make our schools most successful as we try to operate them for the first time with COVID-19 in our community, how do we do this in as safe a manner as possible? The best thing we can do as a community is to actually reduce the amount of virus spread that's happening writ large. The lower the level of virus transmission in our community, the more successful, the safer the school environment will be. I do expect that we will see cases in our school environment. The issue is, can we keep the levels in our community low enough to allow our schools to operate as safely as possible? It won't be, there is no magic, to make it zero, but how do we operate as safely as possible?
Okay, and one follow-up, Dr. De Villa. I was wondering, you sort of touched on it when you were talking about instructions to parents with regards to what public health will do. What advice do you have to parents? I mean, I know there are some in the GTA today who are learning that their school has cases of COVID-19. They may not have heard anything from the school or public health. What advice do you have for any parents who have found out that there is a COVID positive case at their school?
So as mentioned in the remarks, it is our intention to ensure that parents in a school community are aware of COVID-19 cases within their school community. And for those whose children are directly impacted, who have, are at risk for contact or exposure as a result of that identified case, we will work with that family to understand the circumstances of that case. And of course, we're working with the school and the school board as well to determine what the exposure was, who's at highest risk, and to make sure that those who are at highest risk, who are in that cohort who were exposed, are actually self-isolating until such time as we can, more fulsomely determine risk. But just because there's a case in a school, I think it's real that we note that just because there's a case in a school doesn't mean that the case came from the school. And in fact, we've seen in a number of instances, not just, in Ontario, but beyond, that oftentimes it comes from elsewhere. It's from elsewhere in the community, and it just happens to be a young person who's school age. So it may not come from the school, and also just because there's a case in your school community doesn't mean that every single child in that school is at risk. So if you're not notified by public health that there is a need for your child to stay home and self-isolate, we would have people say that continue to send your school as per normal,